Hello viewers, today I am going to show you an interesting case of a child. She is 5 years old and she has presented with pain in the neck and abnormal neck posture. And this is a very interesting case, and I have seen 4 or 5 cases in my lifetime. So it's a rare case which you encounter, and if you don't know about this condition, you will never be able to diagnose it. So the condition is Atlanto-Axial rotatory subluxation in kids after usually a viral syndrome, and it is called a Grisel syndrome. So a patient will give a history of cough and cold. Same with this patient. She has cough and cold for a week, and her father has presented her in our clinic that she is complaining of pain and she is not able to move her neck normally. So I will show you what is her posture and what are her clinical findings. So this is the girl, and she looks quite comfortable, but if you look at her neck position, the neck is tilted. So this is the typical position of the neck that you will see in Grisel syndrome or Atlanto-Axial rotatory subluxation. And what happens is, because of viral infection, the Atlanto-Axial joint C1, C2, there is laxity of the joints and it rotates, and while rotating it gets just locked. And when it gets locked, the patient will present to you in this condition, and this is a typical cock robin position that is described in this syndrome. So the patient the head will be slightly tilted like this, but it is acute. There will be no history of any trauma. Patient will give history of cough and cold as she gives. So this is neurologically she will be intact. So if you see a patient who has got cough and cold and who has presented to you in your clinic, if the neck is tilted, and if I ask her to move her neck, beta ऊपर करना, ऊपर, नीचे, उधर पापा की तरफ देखो. So she is not able to move. She is moving the whole body. So this is the typical position. Now she has history of only 2 days. So she started on Saturday. This is Monday. So if she presents within a week, you just need to give maybe a soft collar, give her plenty of analgesia, and maybe an antibiotic, and wait for a week. And usually when the swelling goes away and the anti-inflammatory works and the antibiotics works, and when child moves the neck, usually it comes back to normal. But if it doesn't come back in a week, then you may have to apply a traction, and that is the treatment of choice for up to 3 weeks. Once it is after 3 weeks and then month, then things become complicated, and then you may have to do something surgically as well. But majority of them, if you diagnose them well, should resolve very well with non-surgical treatment. So this was a typical presentation of Grisel syndrome or Atlanto-Axial rotatory subluxation. There are other causes of it. It is not in kids. It can be seen in adult after trauma as well. So this is one condition that you should keep in mind, and I would request you to read about it, as it is quite an interesting condition. So hopefully I'm sure you find this video useful. Please do not forget to give us a thumbs up, and please subscribe and share our channel. Thank you.